Hi, my name's Julie Lyons and I'm an osteopath. I think the easiest way to define an osteopath is somebody who deals with any problems in the musculoskeletal system, working on joints and soft tissues, basically trying to create an environment whereby the body would heal itself.
How do you do that?
Okay, well, we would use a combination of techniques, sort of working on increasing the range of movement, reduce muscle tension, and ultimately to reduce any pain or discomfort. Soft tissue techniques, which is similar to massage, adjustments, which is sort of what osteopaths are famous for, cracking, mobilisation, stretching, all manner of techniques.
Could you talk about adjustment a little more, if that's so central to what you do?
Well, that's a contentious issue because for some osteopaths it's very central and for others they don't even use adjustments. So it's very specific to the individual osteopath. But the adjustment is where you would put the joint in such a position where you just give it a quick shift and you get it back in place. But you have an audible click, and that's what can sort of shock people sometimes. So a typical working day, for me anyway, would be to see about 8 patients. I'd spend the first few minutes discussing how the patient feels, then get them undressed, do an assessment, some testing if necessary, and then pop them on the couch. Then we'd do some treatment using all the techniques that I just explained. And obviously with the main aim to get them out of pain. I would say that osteopathy is a job that I absolutely love. It's a tremendous sense of satisfaction when you get somebody out of pain, although it's important to realise that you're not going to help everybody. And also it's great, really, really great range of people that you meet, so it's a very interesting job.
What about the sort of studying and how do you get into it?
Well, it's a fairly straightforward route to get to become an osteopath. There's 2 choices. You can do a part-time course, which is 5 years, or the full-time course, which is 4 years. And the benefits of doing it part-time would be that you can work to fund yourself, because it is quite costly. Although I believe that there are grants now. I trained just over 10 years ago and grants didn't exist for osteopaths then. Once qualified, the general route is to find an osteopath and work for them as an associate, drawing on all of their experience. Generally people would work as an associate for 1 to 2 years and then have the ultimate aim to work for themselves. Obviously that's much nicer, you earn more money and you can create a timetable that suits. Very important skills that you need to have as an osteopath. You need to be able to sense what's going on in the body with your fingers. They give you a lot of information and you need to have good observation skills because once the patient's standing in front of you, you need to be able to see what's happening, what's working, what's not working, and that starts to form the basis of your diagnosis and therefore the basis of your treatment.